Good afternoon to those of you connecting from Singapore, and good morning to those of you who are logging in from the UAE. First and foremost, let me acknowledge our VIPs in attendance today. Your Excellency, Jamal Abdullah Al Suwaidi, the UAE Ambassador to Singapore and patron of the UAE Singapore Business Council, Dr. Brian Shigar, President of the UAE Singapore Business Council, distinguished guests, ladies and gentlemen. My name is Rani Kaur, and I am Managing Director of the Global South Asia and MENA businesses at the Bank of Singapore, who is also a corporate sponsor of the UAE Singapore Business Council, better known as the UAESBC. It will be my absolute pleasure to accompany you throughout the webinar as your MC. Ladies and gentlemen, this afternoon, the UAESBC is pleased to present to you our first healthcare-focused webinar. This webinar will set the stage for continued discussions around the various aspects of healthcare with a focus on utilizing technology to reduce cost and improve outcomes. The aim of this webinar is to build an understanding of how healthcare impacts lives around the world, the escalating costs of delivering that care, and how technologies developed in Singapore can create opportunities in the UAE. We are pleased to feature in this webinar a distinguished lineup of speakers representing key agencies in the UAE in the sector, as well as a Q&A panel discussion with representatives from Singapore companies in healthcare HealthTech who have ventured into the UAE market. For more information about each speaker and panelist, kindly click on the link on the program flyer, which we will share with you in the chat window. To begin today's event, it is my pleasure to invite His Excellency Jamal Abdullah Al Suwaidi, the UAE Ambassador to Singapore and the patron of the UAE Singapore Business Council, to give the opening address. Your Excellency, please.
Thank you very much, Rani, for the introduction. Dr. Brian Shigar, President of the UAE Singapore Business Council, distinguished guests and panelists, ladies and gentlemen. Good afternoon to the ones joining us from Singapore, and good morning to the ones joining us from the United Arab Emirates. It gives me a great pleasure to welcome you to this webinar, which is organized by the UAE Singapore Business Council. The United Arab Emirates is one of the most economically developed and diversified markets in the Middle East. And of course, one of our strongest non-oil sectors is healthcare. Since our country's inception 50 years ago, we have developed a robust and comprehensive healthcare infrastructure involving both public and private healthcare providers. One of the 6 pillars in the UAE Vision 2021 National Agenda is to provide all individuals in the country, both citizens and residents, with a world-class healthcare system. In addition to serving healthcare needs for the people, the UAE aims to establish itself as a center of healthcare excellence in the region. In 2017, the UAE was the first country in the world to have a designated minister for artificial intelligence.
We have a meeting today?
This was a major boost for the healthcare space in our country, as it paved the way for new technology innovation in the field.
No private office, he's honest.
As a result of the COVID-19 pandemic, the UAE healthcare sector's resilience on medical technology have taken an increased importance. Among the innovations in the field that have seen a high rate of growth are telemedicine, cross-platform electronic patients record, artificial intelligence, and 3D printing. I am pleased to note the presence of high caliber experts in today's webinar, representing important UAE entities that play a major role in the legislation and promotion of healthcare and health tech, namely the Abu Dhabi Investment Office and the Dubai Health Authority. In addition to the panel discussion, we will be introduced to 3 Singapore companies who have developed amazing solutions and services in healthcare sector, which are being adopted and implemented in the United Arab Emirates. In conclusion, I am confident that by attending this event, all of you here will have a good understanding of how healthcare technology is developed in Singapore can create opportunities for your business in the United Arab Emirates. Thank you all very much.
Thank you very much, Your Excellency. Ladies and gentlemen, I would now like to invite 2 UAESBC committee members from the health tech field, Mr. Steve Weissner from Singapore MedTech Accelerator and Dr. Arpan David from Whitehall Hub. Steve and Arpan will give a presentation on the evolving healthcare sector and investment opportunities in UAE and Singapore. Gentlemen, please.
Hello, Rainey. Thank you very much for the kind introduction. Please allow me just a minute to bring the screen up. Okay, first I'd like to say hello to everyone who's joining us today. This is the first presentation sponsored by the UAESBC on the topic of healthcare. Today's presentation will be diverse and is intended to provide a background of information that will be built upon in future presentations. The data presented today will be pre-COVID data generated by the World Health Organization and the World Bank. As we begin to review the data, please keep in mind that the global impact of COVID has most likely increased the numbers that you will see. During the period of COVID, the global healthcare systems have been pushed to the limit of its capacity. Unfortunately, the impact of COVID will likely be felt for many years to come. I will begin this presentation, and then later in the presentation, I will transfer over to Dr. Arpan David. Our first slide. Let's talk about the total global healthcare spend. The costs associated with healthcare are so large that they will be discussed as a percentage of GDP or on a per capita basis. By 2025, the healthcare spend will comprise 10% of the global GDP, presenting a unique opportunity for investment, research, and design. GDP per capita is expected to reach $12,000 by 2025, representing a compounded annual growth rate of about 2.5%. The global healthcare spend per capita is expected to follow a similar trend, reaching $1,200 US by 2025. Please note the trend, and please note the compounded annual growth rate of approximately 1.75%. let's take this and try to break it down a little bit so we can better understand by region. While the US remains the largest healthcare spender in the world, there continues to be enormous growth potential in the Middle East and North Africa and Asia Pacific. The US will continue to spend the most on healthcare per capita, with approximately almost $12,000 expected by 2025. And please note, this is a benchmark, approximately a 2% compounded annual growth rate. However, the Middle East and North Africa is expected to outpace the US growth in healthcare spend per capita. You'll see that this will be a recurring theme across the globe. The Middle East, North Africa compounded annual growth is expected to be 2.75% over the same period. Asia Pacific is also expected to see a large increase in healthcare spend per capita through 2025. Please note the numbers, the increases, and please note the rate at 2.25%. So you can see the growth of the Middle East and also Asia Pacific is a much faster rate than the US. Let's take a look at China, the largest APEC country. It's forecasted to grow at 2.2% over the next 4 years. And on a per capita basis, those are very, very large numbers. Singapore is a relatively mature market, so it's expected to see a slightly smaller increase. But please note that the numbers are very significant. Let's take a look at some of the primary cost drivers, the things that are driving and increasing these numbers. I think you'll see some trends here that are quite interesting and that aren't often discussed. In almost every country, the proportion of people age 60 and over is growing faster than any other age group, as a result of both longer life expectancy and declining fertility rates. The aging of populations is truly poised to become the next global public health challenge, creating both challenges, demand, and opportunity. The world population is rapidly aging. Between the year 2000 and 2050, the proportion of the world's population over 60 years will double from about 11% to 22%. The absolute number of people aged 60 years and over is expected to increase from 605 million to 2 billion people over that period. This is unprecedented. The number of people aged 80 years or older will have almost quadrupled between 2000 and 2050 to 395 million. Again, there is no historical precedent for a majority of middle-aged and older adults having living parents, as is already the case today. The change in the demographic, the aging of the population, is again going to create unprecedented demand for healthcare. That demand can be answered by looking at the challenge as being an opportunity. Okay, please remember that these slides are non-COVID, pre-COVID. It may be several years before the actual story of COVID is told through data analysis and data groupings. Most older people die from non-communicable diseases rather than from infectious or parasitic diseases. This shows you the trade-off, the numbers between non-communicable and infectious or parasitic. It's important to know that almost everyone who had severe COVID or died from COVID also had pre-existing conditions. Those pre-existing conditions, we'll speak more about those later, are these non-communicable diseases. According to the United States Centers for Disease Control, 86% of Americans over 65 have at least one of the following: cardiovascular disease, which is the leading cause of death among elderly worldwide, arthritis, asthma, cancer, chronic obstructive pulmonary disease, or diabetes. Moreover, 53% have two or more, and nearly a quarter have at least three. At this point, I'd like to introduce a word: comorbidities. In medicine, comorbidities is the presence of one or more additional conditions, often co-occurring with the primary condition. Comorbidities can describe the effect of all the conditions an individual patient might have in relationship to the primary condition of interest. In the discussions, in the headlines of COVID, comorbidities, pre-existing conditions, are constantly mentioned. Please notice that the comorbidities, the pre-existing conditions highlighted as a primary concern for higher susceptibility to COVID are cardiovascular disease, asthma, cancer, chronic obstructive pulmonary disease, and diabetes. So these are the pre-existing conditions which, combined with COVID, has made COVID so deadly. As populations age, emerging economies will continue to increase age-related healthcare spend through 2050. As we've discussed before, the numbers for healthcare in general are rising dramatically. Inside that number, there's a subset, which is age-related healthcare spending. And this graph reflects those increases. In orange, you'll see the 2010 spend. In green, you'll see the forecasted 2050 spend. And then the blue triangles represent the share of healthcare spending increase in total age-related spending, which again is a subset, merely a subset of total healthcare spend. To kind of frame what's happening worldwide, by 2050, India will outnumber the United States and Indonesia. Indonesia will have 10 million people above 80 years old. So here's the United States in 2013, the yellow dot, having roughly 12, 14 million people above 80 years old. You can see that by 2050, that will rise to 32 million. Look at China's growth. Look at the acceleration of the aging of China's population. Again, the yellow dot is the 2010 data point, which was a little over about 22 million. By 2050, there'll be 90 million people in China above 80 years and older. Again, we're seeing a dramatic change that affects countries and cultures. There's also another subset of healthcare, and that subset is medical device. And we just put this up just to kind of show you the trends across the board. It's in therapeutic agents. It's in healthcare reporting. It's in healthcare data collection. It's in healthcare diagnostics. the trend and the spend is increasing dramatically. Healthcare is in need of solutions that address the 5 key topics below. Number 1 is the quality of aging, which is affected by heart failure, diabetes, blocked arteries, and other factors, as we've discussed previously. Quality of aging is really important. All countries need to keep their citizens as productive as possible for as long as possible. And quality of aging plays a key role. If the healthcare can treat patients who are sick and keep them healthy, the individual can continue to be productive. And that's very important for the community and the country as a whole. Mortality rates from non-communicable diseases, and as we know, from communicable diseases, and from the combination of communicable and non-communicable. Less healthcare spend, better, less invasive treatments, less drug dependency, and better cost effectiveness. Item number 4, the preservation of future treatment options. Fewer implants, less irreversible procedures. When a person receives an implant, the physicians have to plan their healthcare going forward, always considering that implant. As an example, I know of a woman who was 72 years old. She had 3 stents, and so she was on blood thinners. She broke her hip. She lied in the hospital bed for 2 weeks before they could treat her hip because they had to reduce her anticoagulants to a point where she could have surgery without significant or possibly fatal loss of blood. So every treatment builds on the next treatment. And when implants are added, you become very restricted in terms of how future treatments and what future treatments you're eligible for. The last is more effective and more efficient administration of healthcare. New processes and procedures to reduce administrative costs. Just to show how people view healthcare expenditure, 62% of patients surveyed thought that pharmaceuticals are the biggest cost driver for healthcare in the US. Now for section 4 and section 5, I'd like to turn it over to Dr. Arpen David.
Sorry, I was on mute. Good afternoon and good morning to those in the UAE. My name is Dr. Arpan. Thank you, Steve. It's indeed an honor to be part of this event today and get the opportunity to share a few slides with all of you. My regards to His Excellency, the panelists, and also all of the attendees. So I'll just pull up my presentation here now. It's a continuation of from where Steve left off. So taking forward from there, I'm going to take it a step closer to the UAE and Singapore and try to set the stage and give a bit of a backdrop to the key presentations that are to come later from the respective authorities. So having first-hand experience in both, I thought it would be good for me to share this. We'll begin with just a simple head-to-head comparison of the costs in both countries. Fairly similar in terms of percentage of GDP spent on healthcare, but we can see that there's a gap in the per capita spend. Now, it's likely that this gap is going to narrow, probably not as you have seen with the costs in Singapore going down, but the cost of delivering care in the UAE is going to go up. Primarily because as the health system evolves and matures, with a growing population as well, is going to have an impact. This is something that is going to come down. Currently, it's probably lower due to some of the cost economics that are in the background, as well as the demographic, the profile of the population. But the important point I'm trying to make is that there is a potential for growth in the healthcare spend in the UAE that is significantly higher than the rest of the world averages that you've seen. So in the next slide, I've pulled out, again, as Steve said, this is all pre-COVID information, and even the forecast may be relevant excluding COVID data. It's only going to go up after that. But there was a recent study that was done that showed the potential of growth in the sector being largely led by the private spend. Government spend will remain in terms of quantum will be high, but the rate of growth will be higher on the private side. It's important to understand this because private investors and private companies looking to come into the Emirates have a very rich and well-structured private healthcare ecosystem to participate in. Not the least of which is because of the excellent insurance framework that has been created, which, unlike many countries in the world, is completely digital. It's an online process, and we'll talk more about that later. But the idea of private investors coming in and benefiting from this economy and this growth story is quite strong. In my next slide, like I said, it's impossible not to talk about health insurance when we talk about the health sector in the Emirates. Health insurance, unlike many countries over here, is a significant contributor to the non-life claims. So almost 65% of all premiums in the non-life segment are health insurance. The health insurance system is very robust. This year, the expectation, again, excluding COVID, the spend for the country is expected to be roughly around $6.5 billion, which is going to grow to $7.5 billion US dollars per year. And like I said, the system is quite well structured. It covers all of the basic benefits, including outpatient and inpatient care. Another aspect to it is the technology platform that is available for accessing claims-related information. The transparency around data is very useful for technology companies in particular, and that's the reason why I'm mentioning that. Also, a very well-managed pharmacy benefits system, or a PBM, which also creates all of the necessary data points for technology companies to come in and participate in that. And so that allows me to go to the next topic, which I wanted to talk about, which is again, the next topic which I want to talk about is technology, which is again close to my heart. I'm a great believer in technology having the ability to solve health problems going forward. And we will see this in the kind of investment that's going into these sectors moving forward. So just to set the stage, last year for the first time, the World Health Organization released a guideline or a strategic objectives around digital health. And I think in doing so, they made digital health or health tech, and I'm using the words interchangeably, front and center and more mainstream of the approach that countries are more likely to take going forward. And a lot of that spend and a lot of those escalating costs can be mitigated by technology, as well as using technology to improve outcomes in the non-communicable disease segment. And like Steve pointed out, the comorbidities, which are often the tipping point for morbidity in other fields. So this over here is a way to measure the growth of the health tech industry. This is the investments that have gone in. As you can see, North America still leads the investment that is going into digital health. But everywhere across the board, it has doubled. Almost $21 billion were invested in health venture funding. So this is not for mature hospitals and clinics, but this is basically technology venture funding, which has been about 21 billion in the first half of the year. It's already more than last year. Asia and Middle East is significantly lower, but the rate of growth is much higher. And where I see potential is in the Middle East, because the penetration of technology, the access to data, the access to an existing technology framework, combined with the mindset of the population being very digitally friendly, particularly in the Emirates, but also in the larger Middle East, is very positive. So these are things that are going to create a fertile user base for even technology companies. And we should see investments going up over here. By the way, I should mention in the APAC region, out of the 4 billion that was approximately invested, about 77% of that went into mainland China. So actually, if you strip that out, there's a significant potential in Asia as well. But penetration of technology is not as high as the UAE in particular and the rest of the Middle East. What do I think from the outside in, looking at potential for investment? And here I'm speaking of technology, not traditional health investments. And again, this is an outside in view. Our panelists and our authorities have a very clear agenda in the Emirates, and they have set that out very clearly, and you will hear from the key speakers later. But this is an outside in view of what we think could be potential themes. Definitely participating in the private sector growth that we've already established is going to happen, working in the public sector to reduce cost. There are concerns around outcomes with regard to NCDs and non-communicable diseases. And I think technology that we have today, combined with the richness of the data and data points available at all points along the care cycle, creates a very good framework within which outcomes can be looked at better, or at least the transparency can be set on these. Another buzzword everywhere is innovation. And I think innovation has to be specific to geography. So there are predetermining factors that lead to that kind of innovation in different places. And I think the Middle East is a bed for its own innovation that suits it. And all of this can be done with a PPP focus. This is one of the countries where public-private partnerships always encouraged. They have been a successful model in the past. And I think any of the private players looking to enter the Emirates are well advised to obviously check with the authorities and look at how they can partner and deliver these models. So from what UAE needs to what I'm trying to change the conversation to what Singapore has done in the past and has to offer in terms of solutions. So looking at the other side of it, Singapore has also been rapidly growing as an innovation hub overall, but also in healthcare. There were roughly, and this is not just COVID related, even before COVID happened, there were roughly around 140 startups in 2017 in Singapore in the health tech sector. Today, as of the end of last year, there were about 400 such companies. Approximately 700 million Singapore dollars has gone into investments last year in 2020, which is almost double of what was there in 2019. But even more important than this is the fact that the government over here has invested not only money, but also created an ecosystem and fostered innovation from a grassroots level up. So there are a lot of companies that have been able to benefit from these initiatives and get out there and bring these products out there. And you will hear from them later in the presentation, and there are many others as well. And this was done not only with a mindset of tapping into the Singapore healthcare system, but the growth story in Asia is going to be phenomenal, particularly with digital health. A recent report said that the market size of the digital health economy in Southeast Asia is currently pegged at around $40 billion, largely again China, which is expected to grow to almost $100 billion by 2025. So these companies can not only benefit from that, but the same kind of platforms and technologies can also be used in the UAE and the Middle East, because there's an untapped market with already the infrastructure for digital connectivity has been laid. The data points are over there. So I think these two things can go hand in hand. And like I said, again, this is an outside view looking in, but I think it sets up a fertile landscape for people to benefit from. That's the end of my introduction. I just wanted to leave everyone with this thought and set the stage for the key presentations to follow, where they would talk more specifically about opportunities in the UAE. Thank you, Rani. Can I hand over, please?
Thank you, Dr. David. So thank you, Steve, as well, and Arpan. Before we start off the webinar, please allow me to go through with you our program itinerary. For your reference, we have shared the link to the program on the chat screen, so you can refer to it anytime. As you can see from the program shared on the screen right now, the event will begin with presentations by speakers from the Abu Dhabi Investment Office and the Dubai Health Authority. Each presentation will include a Q&A with the respective speaker. If you would like to ask a question for the respective speaker, please type your question in the Q&A window. The Q&A window. Please indicate in your question the speaker or company name of who you want to direct your question to, and rest assured I will pick them up. Following the two presentations, there will be a Q&A panel discussion featuring representatives from Singapore companies from the healthcare or HealthTech sector who have ventured into the UAE. This panel discussion will be moderated by Dr. Eitan Constantino, a UAESBC Exco member who is a partner in the Singapore MedTech Accelerator. You may send your questions to any of the panelists by using the same Q&A window of the webinar. Last but not least, the event will end with the closing remarks by UAESBC President, Dr. Brian Shegar. Ladies and gentlemen, it is now my pleasure to invite our first speaker for today, Mr. Mohammed Omar, Healthcare and Biopharma Sector Lead at the Abu Dhabi Investment Office, ADIO. Mohammed will be presenting on the topic of opportunities in healthcare and medtech in Abu Dhabi. Over to you, Mohammed.
Excellent. Thank you so much for that wonderful introduction. And if you'll allow me to just share my screen. Terrific. Great. Your Excellencies, esteemed guests, friends and colleagues, good morning and good afternoon to you all. My name is Mohammed Omar and I'm Abu Dhabi Investment Office's Healthcare and Biopharma Sector Lead. It's a real pleasure to provide some insights on the exciting trajectory of our sector in Abu Dhabi. I'd like to start with a quote from our founding father and first president of the UAE, Sheikh Zayed bin Sultan Al Nahyan. I dreamt of our land keeping pace with the growth of the modern world. I love this quote because it underlines our ethos towards development of all sectors to this day. And ambition and progress are in our DNA, from our heritage to what we do every single day now. And this ties especially well with healthcare, one of the most rapidly growing and changing sectors globally. To give you a snapshot of Abu Dhabi today, we're home to a strong and stable economy, which is one of the top 30 globally. With Abu Dhabi driving over $250 billion in GDP, about 60% of the UAE's total. FDI inflows have been really impressive with approximately 20 billion in 2020, which is a 44% increase over 2019. And our infrastructure is absolutely world-class. Leveraging our strategic position with 80% of the world's population living within an 8-hour flight. Specifically within logistics, through alliances like the HOPE Consortium between the Department of Health and our ports, airports, and providers of cold storage like Rafid, we've really had a strong backbone to our successful response to the pandemic. And we've been able to play a key role in the global response as we moved life-saving supplies and equipment across the globe through ports at Kizad, our air carrier at Ittihad, and those facilities that I mentioned through Rafid. We're set to move over 600 million doses of vaccine alone, actually, globally by the end of the year. So in addition to physical infrastructure, the architecture of our government institutions lend itself to supporting businesses. This is reflected in our high rankings for ease of doing business and our approach to regulation, with 100% foreign ownership permitted across locations and sectors, whether in a free zone or onshore. And we also have zero-rated taxes on personal income, corporate profits, and capital gains. And lastly, it's a place that people love to live. I'm really glad that I've lived here and called it home for the last 12 years. And it's been a really wonderful, dynamic, and safe home for myself and my family. And there's always something to get into. Personally, I love taking lunch at the beach before seeing the latest exhibit at the Louvre, which is just a few minutes away for the next time you come to Abu Dhabi. So building on that overview, Abu Dhabi has a deep and well-connected innovation ecosystem. Our enabling environment encompasses accelerators like Hub 71, which is housed, they're our neighbors over at ADGM. The Department of HealthTech Hub, which is located within Hub 71 as well, supporting all the startups and early stage companies in the health space. And then also the recently announced Block 7 Biotech Innovation Hub over at Kizad, close to the industrial zone, where early stage medical device and biopharma research will be able to take place and translate into products and amazing new technology that's going to change the way that we treat our patients and approach healthcare. This is in addition to existing R&D facilities at Masdar City, which have been well established for quite some time now. So I've touched on our infrastructure already, but it's key to note the advanced connectivity that allows the flow of data and resources that helps entities, both large and small, to reach their goals. Furthermore, we're also home to 16 research universities, including homegrown institutions like Khalifa University and the world's first artificial intelligence university at Mohammed bin Zayed University of AI. And this is combined with international institutions like NYU Abu Dhabi and INSEAD, equipping the Emirate with more knowledge and more talent in terms of publications and in terms of the type of skills that we need to really feed this sector. Furthermore, it's in addition to our heritage of openness and tolerance, as we've proudly welcomed a multinational workforce for decades and made huge strides in inclusivity, particularly with regards to gender inclusion. And that's happening at all levels within the public and the private sector. And so one last point is, of course, our vibrant investment community. From sovereign wealth funds like ADQ and Mubadala to private investment corporations, we have a plethora of players investing across all parts of capital, whether it's debt, equity, growth equity, venture capital, or mezzanine facilities across the entire value chain. And this is in addition to our robust banking system and established capital markets, with initiatives like the recently announced 5 billion dirham IPO fund supporting local listings. So in terms of our healthcare ecosystem, what we've seen is that this innovation ecosystem, in addition to all of the infrastructure, was kind of tangible and intangible that I've talked about, it's resulted in a really impressive interconnected tapestry of players within the healthcare ecosystem. So if you look over here, some of the names that might jump out, what's immediately apparent is Abu Dhabi's track record of successful international partnerships. So we've seen the growth of large hospitals like Cleveland Clinic Abu Dhabi in partnership with Mubadala, and Mayo Clinic in partnership with Saha, Sheikh Shakhbout Medical City, and of course Johns Hopkins at Tamam. We've also seen meteoric growth of private players like Mediclinic, UAE Medical, and Burjeel, with patients availing wide options for care. And this is supported, across the board. So I've mentioned some of the incubators: Hub 7, T1, Flat6 Labs, Plug and Play. But this reaches further into medtech and med startups, with the first regional provider of telemedicine being in partnership between Mubadala Health and Medgate from Switzerland, and then recently announced partnerships between Honeywell and Strata for producing medical supplies, and then also combining our research labs and pharmaceutical capabilities within the Emirate to add more and more options and further increase the scope of the value chain within healthcare and biopharma in Abu Dhabi. So to kind of build on that, I can talk about healthcare and biopharma in Abu Dhabi today and where we see it moving tomorrow. So within the sector at ADIO, we can break it up into probably 3 buckets plus a bonus one. So the first one would be biopharma. So this is everything from biopharmaceuticals, large molecules, biologics, so on and so forth, to advanced pharmaceuticals with more traditional kind of chemical bases as well. So in terms of the specialization, the benefits, and the growth trajectory of this in Abu Dhabi, it's a hugely growing field, with examples of most recently between G42, of course, one of our large private players in Abu Dhabi, both in healthcare and cloud computing, teaming up with Sinopharm out of China to localize vaccine manufacturing and widen that kind of biotech environment as well. A second bucket would be regional issues. So these are areas that are addressing the most pressing concerns and the most growing kind of health needs of the region and of Abu Dhabi as well. So examples of these would be key disease areas, looking at non-communicable diseases, and of course examples would be cancer, diabetes, so on and so forth, which of course they're not limited to the region, but the huge focus means that coverage and all the available healthcare coverage is available here, right? So the idea here is to grow from simply treating the diseases or preventing them using kind of traditional methods to using new technologically enabled methods to do that. An example would be the National Genome Project, which was launched in 2019 in partnership between G42, Saha, which is the largest public health provider in Abu Dhabi, and of course the Department of Health, in sequencing the genome of the UAE population, deriving insights that can then be used to make positive interventions in healthcare. So moving on, from that as well, we have a medtech interest, of course, and this is a very, very broad field, as we've all discussed. It can be everything from something as invasive as a new kind of pacemaker or a deep brain stimulation device, like those that are currently being trialed in Abu Dhabi for neurological disorders, so on and so forth, all the way through to software and technology that allows greater communication between the healthcare regulator in terms of quality and outcomes, to payments, to insurance companies, and so on, to providers in terms of using that patient data to really improve the quality of care, and also improve their operational efficiency at the same time. The fourth bucket, which is the bonus bucket, is the fight against COVID-19. And we've, of course, been very, very closely aligned with our partners in government, specifically the Department of Health, in terms of really aligning to that strategy and supporting companies that are aligned to that vision as well. Lastly, what I might mention here in terms of setting the scene on the sector is that Abu Dhabi has really excelled in terms of provision of healthcare. We've been able to make available to all residents world-class care and availability to the most high-end and most new technologies that are used globally, including a plethora of regional firsts, specifically in transplant. But what we're seeing in the future in terms of where the sector is moving, is really an expansion of that value chain. So if you think of provision and something that faces patients as one part, you can look further upstream to looking at the development of new devices, of software, and all the way from R&D to manufacturing to then being made available to patients. What we see in Abu Dhabi is that availability has been able to drive a massive amount of data, which is now being collated and put together and made available to healthcare institutions through the Health Information Exchange, called Maleffi, which is the region's first most comprehensive health information exchange. So what we have is an incredibly data-rich environment, which then itself can be used to reinforce new kinds of inclusive research and development that leads to new healthcare technologies, both on the device side, the software side, and also even the technique side, that can then be applied to improving healthcare and improving people's lives. So maybe I can tell you a little bit now about Abu Dhabi Investment Office itself. Right? So ADIO is the central government hub supporting private sector investment in the Emirate of Abu Dhabi. We support investors' businesses with innovation at their core to grow sustainably and in the long term, both in Abu Dhabi, across the region, and globally as well. So you could kind of break down our role as promotion, attraction, and facilitation. So just to kind of make it a more functional approach, we of course have three major verticals within ADIO. So one of them is our investor care service, which is our end-to-end investor support service that helps companies establish themselves seamlessly and have access to all the data they need to really succeed. We also have, of course, our incentive instruments, and this is typically where myself and my team get to work very, very closely with the companies in looking at their plans and matching them with our kind of financial support programming in the form of our pay and reclaim rebates, which I'll tell you a little bit more about as well. We also have our infrastructure partnerships, or PPP, public-private partnerships vertical, which takes care of PPP projects and manages PPP tenders on behalf of the Abu Dhabi government. So taking a dive into investor care, some of the areas of support are within, of course, I mentioned data, but then this goes to everything as foundational as how to find an office, right? Identifying the most cost-effective and workable solutions for your employees, getting all the information you need to obtain talent, to obtain access to local pools of talent, and then also smoothing that process of bringing in talent from all around the world. And then everything is foundational as starting a bank account or communicating with dedicated relationship managers at the particular institutions. And then also about, once you've established, of course, being able to have access to all the sort of networks that you need to get your business off the ground, in addition to all licenses that are required. In terms of incentives, of course, working with Abu Dhabi Investment Office has a range of financial and non-financial incentives. In terms of non-financial, it's all about being plugged into that very well interconnected ecosystem. It's about leveraging different initiatives that are available across government, whether they're at the Department of Economic Development, the Department of Health, or any of the other kind of government institutions, to make every company able and positioned to really benefit from all of the wonderful initiatives. These could include regulatory assistance, visas, trial licenses, so on and so forth, and potential exemptions from government fees and requirements as well. And so what we do is we work very closely with the companies to understand every lever that we can pull on to make sure that the full force of the Abu Dhabi government is behind your success. In terms of financial incentives, we, of course, I mentioned briefly our rebate programs. So specific to Abu Dhabi Investment Office, these are where we would work with the company, understand their plan very deeply, and then assess each kind of cost center that's related to an innovative practice, and really support on those. And so in terms of equity investments, I've mentioned that ecosystem for raising capital. We, of course, share our pipeline with our partners and and also kind of Abu Dhabi government-owned institutions like the sovereign wealth ones we mentioned, to make sure that everyone has each opportunity on the radar, and that no opportunity to collaborate is missed. So diving deeper into our IDEO financial incentives, we do a qualitative and a quantitative assessment of course, the company's plans, what they're looking to do in Abu Dhabi. And so in terms of quantitative assessment, we would look at metrics like the number of high-skilled jobs that are being created. We'd look at the number of Emirati jobs being created and local involvement in upskilling. We'd look at, of course, the volume of capital expenditure related to innovation. So this would be high-tech equipment, high-tech machinery, and the setup of high-tech facilities, for example. And then, of course, more quantitative impacts on Abu Dhabi's wider economy. In terms of qualitative, this is how we assess an opportunity for alignment, as I mentioned earlier on, with the strategy of Abu Dhabi more widely. If you're a company coming into the Emirate, is there a strategic alignment? Are you focusing on tackling something that is very, very pressing here in Abu Dhabi? Are you aligned to that Vision 2030? Are you part of that growth story within healthcare and biopharma? That's something that we're looking to support and looking to reward, of course. We look at the disruptiveness of the technology because it's important, of course, to change the way that we do things in Abu Dhabi, but also we look at the impact this is going to have more broadly, and of course how aligned it is with our priority clusters. And our rebates are entirely non-dilutive. They're made on a pay and reclaim basis, and we don't take any equity, IP, or any operational management of the business. We like to keep ownership and equity with the companies and let them keep all the upside that they generate. This is pure government support. Here, there's a small kind of overview of the way that we work within infrastructure partnerships. And so these are facilitation arrangements between private sector entities and the government partnerships. So for example, in innovation and efficiency, an example would be the placement of energy efficient LED lights for all the street lights in Abu Dhabi. But this of course extends to kind of larger government contracts as well. We have a robust governance structure and a stage gate approval process for this as well within public-private partnerships, and everything is incredibly transparent, and we make everything available each step of the way to all participants in a way that ensures transparency and fairness, of course. And so something I direct everyone to do when they have a minute, they have a chance, is to take a look at our Abu Dhabi prospectus, understanding a little bit more about the Abu Dhabi value proposition, the way that Abu Dhabi can fit into your global growth plan, and help take you as a company based primarily, for example, in the East, to get you a little bit closer to the West, or to, which we also do the other way around as well. But also how you can use Abu Dhabi as a really good jumping off point. A place where you can take your business to really become kind of a global enterprise, reaching more and more markets and more opportunities. And I'd also ask you to take a look at our investor guide too, to help you have an idea of the pathway for moving within Abu Dhabi and how IDEO supports that. So please do get in touch. I've had the chance to connect with some of the folks who are joining us today. Over LinkedIn, so on and so forth. But please do reach out, please do connect. And I would be delighted to talk about the great opportunities to collaborate together within Abu Dhabi, with Abu Dhabi Investment Office, with our ecosystem partners, and to have you visit us as well. Thank you very, very much. It's been an absolute pleasure. And I'd be very, very happy to take any questions at this moment.
Thank you so much, Mohammed. That was really interesting, the way you showcased it from a macro, as well as then going deep diving into the details. Very, very informative indeed. we're going to open the Q&A. So we have some questions for you, Mohammed. I'm not going to let you go off so easy. Thank you, everyone, for your questions. Let me just go to the first one. The first question is, where can innovative companies in healthcare and biopharma develop new technology and grow in Abu Dhabi?
Terrific. Well, thanks so much for the question. So within Abu Dhabi, we've managed to interface, we've managed to work with lots of different size companies. So you may have a small startup that's incredibly innovative and has a new disruptive idea. But then you also might have an innovation group within a large established company, right? Which may want to set up an innovation center. So for those, we've seen them able to set up in places like Masdar, where education and innovation centers can be set up to kind of co-generate data on new devices, and these can be kind of your large kind of medtech players. And then all the way on the other side of the spectrum, we've seen the use of places like Hub 71, and of course the incoming Block 7 for a more kind of technical and more kind of resource or lab resource intensive kind of company would use that. But what we've seen right now is, and I'd really invite everyone to come and take a look at it, is within Hub 71, where we've seen kind of smaller groups, smaller teams, being able to set up in this co-working space to kind of cross-fertilize ideas and really have an opportunity to be close, not only to other innovators that they can kind of, as I mentioned, share ideas with, but then also be very, very close to investors within the VC community, the venture capital community that also co-locate there. And they also, of course, take advantage of the fact that the Department of Health has their health tech hub located there too. And so that's been something that's been really, really useful to help kind of innovative companies grow there. And it's also very close to several large hospitals, including Cleveland Clinic, where they have access to kind of physicians and other also academic physicians too, who also produce a lot of research whereby they can collaborate on innovation projects or sharing data, learning more to develop their products further, and then eventually commercialize them.
Thank you for that. Sounds really exciting. Can't wait to visit, actually, just the way you were describing it. There is another question. Actually, one. Okay, let me just go to the next question. The incentives mentioned by ADIO look interesting. What is the benefit for ADIO to offer such incentives to foreign companies?
Sure. So as Abu Dhabi Investment Office, we're really here to, of course, support companies coming in, but then also support the economy of Abu Dhabi more broadly, right? So it's something that does kind of come up, saying, okay, well, if you're injecting capital into our companies in a non-dilutive way, okay, well, is it something that we have to eventually pay back? Is it something that we somehow need to bring back to you? And for us, we look at it from kind of a more macro scale, right? A more macro level. We say, okay, great. This is a company that's coming in. We are contributing through these rebates, right? And what that's allowing this company to do is to think bigger or think faster, because a lot of that risk has been kind of de-risked through the rebates, right? So what we see there is a company when they might think of saying we're bringing, 50 jobs, 60 jobs with these rebates. They may be thinking about bringing on 200, right, within that same 3-year period, or moving more and more people, more and more equipment to be more productive here within Abu Dhabi. And of course, that provides, huge economic benefits and kind of downstream, right? In terms of these are people who are living here, these are people who are bringing their talents here, building a home for themselves here, and contributing to the wider economy. So that's really what's in it for ADIO. And the success of this company, it's one that comes in and grows into a multi-billion-dollar entity and lists on our stock exchange, or does a dual listing with us here in the NASDAQ. that's wonderful. That's a huge success story, and it's something that we're looking to support, and we want the companies to benefit from that.
Thank you for that. And we have one question, the final question. Fortunately, only time we have for from Mohammed Sohail. Please share how medical device regulatory experts can avail of professional opportunities in Abu Dhabi, or what other opportunities, I think you paraphrased, available to such regulatory professionals there.
Great. So one thing I mentioned earlier on was the HealthTech Hub, right? So of course, working in healthcare and biopharma at ADIO means that I'm constantly interfacing with our colleagues at the Department of Health. We take a really one Abu Dhabi approach when we're working with companies that are growing here. So what we'll find is that there are a few different options in terms of regulation, right? And that varies depending on the company. So if you have a company that is looking to do a clinical trial, for example, for a particular device, or late stage kind of clinical trials of pharmaceuticals, right? What you'll have is companies like that usually having someone or needing someone on kind of course, on our side or on the government side to manage that process and to open doors and to expedite processes for them. But this creates also, this creates an opportunity for people to come and support those companies. It creates those sort of opportunities within the private sector where they would bring on someone with regulatory knowledge and regulatory professional backgrounds, right? And that's another part of the kind of high-skilled workforce and high-skilled people that we really appreciate and find strength in these companies. So in terms of opportunities for regulatory professionals, those are also areas that will expand as those sort of people are required by entities that are doing clinical trials, that are getting their products, services, and other offerings approved clinically, even with all the support that's offered kind of on the government side.
Fantastic. Thank you so much. Thank you for your time. Ladies and gentlemen, it now gives me great pleasure to invite our next speaker, Dr. Ebtissam Al-Bastaki, Director, Investment and Public-Private Partnership Department at the Dubai Health Authority. Dr. Ebtissam will be sharing on the topic of investment and PPP opportunities in healthcare in Dubai.
Good morning, everyone, and good afternoon to people from Singapore. My name is Dr. Ebtissam Al-Bastaki. Thank you for introduction, and I'm heading the investment and PPP department within Dubai Health Authority. And thanks for my colleagues that they have shared a wonderful presentations, which is actually looking at the global UAE, Abu Dhabi. So I'm going to take you now through Dubai market and how does the opportunities and gaps looks like in the healthcare system. And I really want to share with you my experience and our experience in DHA in regards to the PPP, public-private partnership. 2 days back, we had a conference with the Department of Finance focusing mainly on the PPP and upcoming PPP project, which might be an opportunity for all of you. Let me share my screen. Okay. So we all know that on the 4th of Jan in 2019, His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President and Prime Minister of UAE and ruler of Emirates of Dubai, he announced the 50th Charter. And in the article number 5, he focused and emphasized on the doctor to every citizen. And I think this is a really important initiatives was done by the government to encourage all the technologies and telehealth and telemedicines companies. Of course, we as a government sectors, we were working a few years back by having the companies existing in the market, but the mindset among the population was not there until the COVID-19 has hit. And this was a really important tool that we used during the COVID-19 and lockdown period, that especially the chronic disease patients, such as cardiovasculars, oncology patients, they were so worried in coming to the hospital. So using telemedicine and telehealth was really an adding value to the system itself. So technology and digital health, it's a really a momentum of healthcare transformation in the healthcare system itself, and it will add a lot of value to our patients. So Dubai is a vibrant city, and it has a lot of opportunity for investors, professionals, entrepreneurs, and that's because Dubai, it's a hub, it's a city of 200 nationalities, age groups between 15 and 64. So you will understand like what kind of disease that we are predicting here, as well as in the gateway because of the airline and destinations and port and transport that we have. And if you look at Dubai Healthcare, we as a Dubai Healthcare Authority, we're the regulatory body. We regulate the whole market in Emirates of Dubai. And there are few just hospitals run by Ministry of Health, but the majority of hospitals is being regulated by the government itself. But if you look at the figure here, you can see that most of the outpatient and inpatient volume has been increased since from 2012 to 2019. And that's because of the growth in the private market. And as well, you can see that the public hospital remains the same in the last 10 years, but however, there was a tremendous growth in the number of hospitals in the private sector. So that will indicate you how the market is being running in the Emirates of Dubai. If you look at the outpatient and inpatient roughly, we have 20% run by the government sector, 80% is actually the market share is by the private sector. The health expenditures has increased by 4.8% from 2018 to 2019, and that's because of the mandatory health insurance in the Emirates itself. And 59% of that expenditures is going towards the curative services, and 14% is around the ancillary services. And UAE, it's considered to be one of the most efficient healthcare system across other countries. And these are considered to be as well one of our main drivers when it comes to the health investment. All these data, by the way, it's available in our new launch guide. If you just log into our DHA website, look for Investment Guide 2021, you will find all these information available to you. But I'm going to take you through it, and you can basically understand how the market is look like today and how it will look like in coming future. So based on our capacity planning, we found that there will be a gap in number of beds in 2025 as well as 2030. So there will be a gap, and the gap mainly will be focusing on certain specialties. The highest will be orthopedic, and the other specialties such as obstetric and gynecology, respiratory, and others. And of course, there will be some focus on the outpatients rooms such as primary health care, rehab beds, and long-term as well. Now, in the outpatients services, anything in red in the numbers mean it is an oversupply. So we always focus on the undersupply services. For 2025 and 2030, you can see that primary care, endocrinology, respiratory medicine, gastroenterology, neurologies, these are the specialties that require to be invested in near future. So either the government will invest or the private will invest, or maybe we can go as a PPP. That's something that we are looking at it. And I'm going to share with you more about those projects in the future. And similarly, that will go for the inpatient beds, where you can see that there are certain specialties that we really need to focus on for the inpatients from 2025 until 2030. So as I mentioned, anything in reds mean it is an oversupplies in the market. So this will give you honestly an idea how the market is looking like in terms of the specialties, outpatient versus inpatients. When it comes to the sector gap as an outpatient rooms, you can see that, for instance, sector number 3 is oversupplied. So it's condensed with the hospitals and the clinics. But if you look at the other sectors in the Emirates of Dubai, you can see there is still some gaps and opportunities that will give to the private sector to look at it, whether it's for the hospitals or daycare facilities or for center of excellence, or maybe innovative primary healthcare setups or the polyclinics. And that's all will go hands by hands along to the capacity planning that I have mentioned it earlier in my early slides. So you can see that from here that there is still some kind of an opportunities for the private sector to invest, whether it comes as an infrastructure or as a services or from the technology point of view. So let me summarize that. The priority of the investment area from the health investment in Emirates of Dubai. So we are pretty much want to focus in the next 2 to 3 years on the diagram, which is on my left-hand side, which is innovative primary health care, ambulatory care, urgent care, mental health. Mental health is something really important, and I think this is will be an issue in 2030. We all know that more than 300 million people are suffering from depression, and the number will be leading as one of the top diseases in 2030. So this is something even it is worthwhile to think of it, where we can bring a lot of innovations and technologies part of it. Of course, we have other stuff that we need to look at it, like urgent care and ambulatory care. And when it comes to the next 5 to 8 years, we would like to focus more on the precision medicines and the pharmacy beyond the pills and population health management. This is something that the governments and the policymakers, they are working on it, and will be the focus on the upcoming years. So if you really would like to think of investment, Dubai has launched a platform called Invest in Dubai, and this will give you a lot of insight what to invest and where to invest and how to invest as well. And if you are really keen to invest in terms of the facilities or professionals licensings, of course, our DHA regulatory and licensing departments are available and can assist you at any time. And we as an investment department working closely with our regulatory body, and we have initiated something called Certificate of Needs, and that's to regulate the market to balance between the supply and demand, so we don't have oversupply in one area or undersupply in the other area. So we would like to balance it, and of course to incentivize the investors in terms of packages based on the requirements that the populations requires and needs. So let me go to the other now aspects of our department and what we are doing at the moment. We work as well very closely with Department of Finance, and Department of Finance, they do have PPP law, which is public-private partnership law and public-private partnership guidelines. And if you really want to access to these information, it is available at Department of Finance website. And of course, it's very important when it comes to the PPP that both sides, the public and the private sectors, needs to do their due diligence, the feasibility studies. They really need to work together in terms of how to allocate the risk between the public and the private sectors, and to have the best financial models, which can be as a win-win situation for both. So currently, we have executed 2 projects and 2 investors. One is an international investor. The other is actually as an international investor, but they are based in Dubai, won the projects. The Dialysis and Dubai Physiotherapy Rehabilitation Center, these are the 2 centers belong to the department, DHA, Dubai Health Authority, and it is a PPP model of operational and management. So usually in operational management, you have, in PPP, you have a different model. You have an infrastructure model and you have the operational and management model. So dialysis and DPRC is basically an operational management model. So where the whole service is given to the private sector, and there is a financial agreement between the government and the private sector to run the service based on the clinical KPIs. And these are now the 2 projects that we are working on it, and it's in the pipeline. Maybe it could be an opportunities for you to look at it as well. Both are still under tender process at the RFP stage. One is Cardiology Center of Excellence, and this is a typical PPP, what you see in Australia, in Canada, and other countries like even UK, where you have a design, build, financing, doing facility management and transferring the building after the life cycle of the contracts to the government sector. And in the Cardiology Center of Excellence, the operational part, the clinical operational part is being given to the government sector, while in the long term, it's 100% concession where the clinical part is given to the private sector. So there are different models, but they run under the same concept of the PPP guidelines and law. And of course, there is another one which we are working on it. This project will be finalized in 2 weeks' time. We are into negotiation stage. It's an operational management. It's a transfer of post-acute patients to the private facility where they can manage it based on the clinical KPIs. And this is actually my last slide. I'm going to emphasize on this. This is a project that we announced during our PPP conference. And one is the Rashid Hospital redevelopment, where it's an infrastructure. Both of them, the Central Laboratory and Rashid Hospital redevelopment, are both of them are the infrastructure PPP concept. But the government and along with Department of Finance and ourselves, we're going to work on the feasibility study to restructure the model and to see what will be the best for the public and the private sector. And these are the 2 upcoming projects for the next year. And I would advise all of you to keep an eye on our GRP system within our supply department in the DHA, where you can have a lot of interesting projects might be interested to you. And if you have any further questions, I'm available here. So I think I just reached to my end of my presentation, and I'm willing to take any question that you have. Thank you very much.
Thank you so much, Dr. Ibtisam. I mean, it was very, very interesting. Thank you for sharing all the details and the exciting initiatives that are also up and coming. We do have several questions for you. So if you allow me to begin with the first one.
Yes.
What are the key enablers for a successful PPP program?
Of course. So there are certain main key enablers which makes the market even more sustainable. So being or having investment unit and departments within the government, as well as the guidelines and the law by the Department of Finance, this will create a lot of competitiveness in the market. It will attract lots of FDIs. It will increase the sustainability between the public and the private sector, and it will encourage the platform for the PPP projects.
Yeah, I think it makes absolute sense what you just shared. Moving into the second question, what are the needs and opportunities of healthcare in Dubai? I think you may have touched a bit on that, but if you could just elaborate on a few.
Yes, I have touched on that. You have seen that based on the capacity planning that we have, you can see how the market is shaping. You can see that there are still some gaps and opportunity in certain specialities that we would like to work with the private sector. Either it can be a private investment, or it can be as a PPP project. So, so the market is still, you have a gap in it. You can see that I have touched some of the areas like mental health, rehabilitation, long-term care. We have, as I mentioned, a project is still within the tendering process. The tender will be ending by end of November. So this is something that we are looking for various players to come in and pitch for it. So, and why we are looking at the long term, because we want to kind of like shift our patients from the acute care to the long term, and then to the home care, supported by the digitals, by the rehab services, to create kind of like an ecosystem in the market. So yes, there are some gaps and opportunities based on the specialty of outpatient and inpatient. And if you're really looking for more of those information, please look for our investment guide, which has recently been launched 2 days back. It's version 2021.
We have time for one more question, Dr. Ibtisam, and this actually connects to your earlier point on long-term care, palliative care, and various aspects of care post-acute care. The question is from Mr. Karthik. Would you be able to provide the number of nursing homes that are likely to come up? Similarly, is there a projected demand for home care? Which one is preferred by DHA, nursing home or home care?
Okay, see, nursing home, I mean, it's gonna fade slowly. I mean, people are all shifting towards home care. So what we are doing here in DHA as a government sector, we looked at the market, and we saw that based on the capacity planning, we required rehabilitation, we required long-term, where the patient can be shifted immediately from the acute care to the long-term for certain period of time based on the policies that the government will launch soon within, I mean, Abu Dhabi has the mature policies in this aspect. Dubai, we are working on it. So hopefully in a couple of months, we are expecting to have the policy there through our funding team. So therefore, this will go hands by hands with the project itself. So home care definitely more than the nursing home. And I think by having home care, long-term and rehabilitation, you're creating a good ecosystem in the market, as well as for the patients, because see, whatever we are doing for the sake of the patient. Patient is the center, and we are working around it. And that's because we want to reach to value-based healthcare. We saw that the cost is rising. So how basically we can make it more cost-effective in terms of quality of care. So doing so, we really need to create kind of an ecosystem in the market itself. Of course, government by itself can't do it. We, especially in Dubai, private-driven. So therefore, we want to work closely with the private sector.
Thank you so much, Dr. Ibtisam, for your wonderful answers and for sharing such interesting information and useful information with us.
Thank you,
It's a
Rana.
pleasure having you. Ladies and gentlemen, we have now come to the panel discussion segment of the webinar. We will feature companies in the healthcare health-tech sector who have ventured into the UAE. If you have any questions for any of our panelists, please, again, just a gentle reminder to use the Q&A window and to submit your questions there. It is my pleasure to introduce the panelists for our Q&A panel discussion. We have with us today Mr. Raymond Mo, Chief Executive Officer, BioMind, Mr. Rex Tan, Chief Technology Officer, Avis Health, and Mr. Tirupati Karthik, Chief Executive Officer, Napier Healthcare. Please refer to the program link shared in the chat window to browse through the profiles of our panelists and speakers. Great profiles, please do have a look. Ladies and gentlemen, it gives me, I'm really excited about this part, to hand over the proceedings to the moderator of the panel discussion, a prolific speaker himself, Dr. Eitan Constantino, partner, Singapore MedTech Accelerator. Dr. Constantino, over to you. Thank you so much.
Thank you very much, Rani. We have a wonderful panelists today, a good growth and success stories from the Singapore-UAE collaboration. And to begin with, I would like to invite each one of them to give us a 5 minutes introduction that will be followed by 2 minutes question for me or from the audience. So our first panelist will be Mr. Raymond Mo, the CEO of BioMind. Raymond, welcome to the panel, and please take the time to introduce your company and yourself, and I will follow up with a question or two.
Hello. Thank you, Dr. Constantino, for having me here. So for myself, I'll be introducing what our company does and how we actually work with the important stakeholders, and especially in GCC as well as the greater markets in general. So BioMind is actually I would say a hardcore deep tech company in the area of deep learning, which is a very specialized area within the artificial intelligence arena. So what we essentially do is to develop proprietary applications to empower physicians, the doctors themselves, to be better in their jobs. For example, in diagnosing patients, in terms of treating conditions and even rehabilitation. So over here, you see a picture on one of our research centers for brain conditions. And this is located in Beijing. So that's one of them. So overall, we have around 300 staff globally. We have 3 offices in Singapore, in Luxembourg in Europe, in Beijing. And recently, in this particular year, we also expanded our operations into UAE. So we do hire a couple of our colleagues to penetrate the market there. So all in all, our solutions have been used by hospitals. The users are people like radiologists, neurologists, and even surgeons in some hospitals. So really what we want is to tackle some of the problems that have plagued the healthcare industry for many, many years is basically can be summarized into these 3 buckets, right? So first of all, when it comes to the efficiencies in the healthcare system itself, we all know that there's a lot of I would say gaps within the process of processing, analyzing data, and it can take a long time to diagnose a patient and generate into a medical report. And also when it comes to the accuracy of diagnosis, and unfortunately, the trend has been quite disconcerting. We are seeing that the number of misdiagnoses or blind spots have been increasing on a year-on-year basis. So the question is that if we can just tackle 1% of these numbers, we are talking about saving the lives of hundreds of thousands of people in a big country alone like US, China, and even UK. And to make matters worse, we are seeing that there's a huge shortage in terms of the healthcare manpower, especially in the area of medical imaging data, which takes up a huge chunk of medical data. 90% of data is related to images, and they are not keeping up with the demand for their services. And all this have resulted in a huge variety of issues, from fatigue issues, wrong treatment, etc. So this is where we are tackling, you can see, a very complex engineering and healthcare problem. Is basically a hybrid discipline. And what we do is to train our machines to recognize patterns in the data and to incorporate the expertise of doctors to come up with the ability of the machines to do a couple of various functions over here, right? So over here, you see a system. So this is an AI system. We work with more than 100 brain specialists in this case to be able to tackle some of these issues. Like for example, from the medical scans, we are able to flag out anomalies. And not only do screening, we are also able to recommend the diagnosis for the patients and also enhance the visualization of some of the blood vessel related conditions and to generate a report automatically. So you can see over here that this is a structured report that has been 100% generated by AI using NLP. So no longer doctors have to type out every word. So this is a structured format that doctors can review and then approve accordingly. Right. And in 2020, last year, we also pivoted our solutions to tackle the COVID-19 pandemic. Essentially, our machine is able to also detect COVID-19 pneumonia on CT scans to overcome the issue of the long turnaround time of PCR results, especially at the early start of the pandemic. All right. And we have also gotten the Singapore HSA approval for this and a few countries as well. And we have since expanded, these applications to tackle other viral diseases because we think that AI is the future to manage disease. So this is a picture to show, how we have also helped to combat and contribute in this fight against the COVID-19 pandemic. And in the World AI Conference held last year, we were being awarded to benefit, the humanity in this particular area itself. And I'm also very thankful for UAE Business Council, to help us to profile us, and also the Abu Dhabi Chamber of Commerce last year, and that helped us to develop market traction in the early phase of our market penetration into UAE. And here are some reports that talks about, how we use technologies to benefit mankind. And I especially like this quote by WHO representative Dr. Gordian Golia that says that our application can help doctors in rural areas, right? And especially our mission is to decentralize and AI-enabled high-quality healthcare services to areas outside the city, right? Where traveling, where access to medical care is highly limited. And by doing so, we can scale good medical expertise in these areas where they do not have well-qualified and well-trained doctors. And last but not least, I think you can find a couple of articles about us online. And all in all, the common denominator is about how, the combination of human as well as machine intelligence can create synergies, especially in the area of enhancing the performance of the doctors, not only in terms of the workflow, productivity gains, but importantly in the diagnostic, the treatment as well as the prognostic accuracies can all be significantly enhanced. Right, very short introduction of our company. Thank you.
Thank you very much, Raymond, for the fascinating introduction. I would like to ask you one question. So you mentioned many things in your presentation, but I was intrigued by the ability of your solution to clear backlog issues for physicians. Maybe you can elaborate on how this backlog issue was emphasized or not in light of the global pandemic we are facing.
Sure, and this is actually a serious problem, right? And experts have mentioned and in fact have described this issue as the crisis after the crisis. Why? Because of the resource constraint in the hospital, a lot of routine examinations and appointments have been delayed or pushed back so that they can make way for the existing medical staff to prioritize on the COVID patients. So while we are tackling an issue of optimization of healthcare resources, okay, and while the COVID-19 suspected cases continues to be addressed and managed, but it is important that there should not be delays even for the routine examinations, because for some conditions, right, it is a matter of life and death. And for chronic patients, they continue to suffer without given the opportunity to be addressed and administered by the physicians itself. So what we do is that essentially when we tackle conditions like that in hospitals, we are doing two things. One is to use AI to help to automate the process of dealing with the routine examinations with regards to analyzing medical images so that they are not turned away or pushed back. The appointments still carry on. But at the same time, because we also use AI in the area of COVID-19 management. So for example, either by way of incidental findings or a deliberate scans using medical scans to sieve out patients suffering from COVID-19, our solution can flag out this COVID-19 pneumonia very quickly in a matter of seconds. And that helps to provide an early triaging, and so that the suspected cases can be immediately triggered a isolation protocol. So basically using AI, we are helping two groups of physicians to tackle, these patients. And the objective is such that the hospitals, using their existing manpower, they can handle as many patients within the same period of time.
Excellent, fascinating technology, and congratulations for the progress. I would like to invite our next panelist to introduce himself and his company. Dr. Rex Tan is the CTO of Aviation Health. Dr. Rex, please go ahead. Dr. Tan, you're on mute if you don't mind.
Yeah, I noticed that. Sorry. Can you guys see my screen?
Yes, we can.
Thank you very much for having me. Good morning and good afternoon to everyone in respective places. I'm Rex Tan. I'm the CTO of Aviation Health, which is a Singapore medical startup. As compared to BioMinds, we are pretty young of a company here. Very glad to have the opportunity here. Let me just take a couple of minutes to introduce what we do in my company. So essentially, if you see at the title slide, we are making wearable stethoscope, but a little bit more of intelligence putting into this stethoscope for remote patient monitoring. We are in fact tackling quite a serious problem, as some of the speakers earlier have mentioned. Respiratory health is one of the largest challenges in the world. And there are a lot of people being affected, especially suffering from chronic respiratory diseases. And these diseases can often be deadly if they are not managed properly. One striking thing that our company is trying, that motivates us in developing our solution is we learned from statistics that almost 7 people die every minute due to chronic respiratory disease. And from a lot of case studies that we see online and on the scholarly platforms, many of these deaths can actually be prevented because some of them are due to lack of adherence to treatment or due to the lack of monitoring during critical periods. So this is one problem that we are trying to tackle. That I've briefly explained already just now. For chronic respiratory disease, in Singapore, at least where I am, two of the major ones are asthma and COPD. They do present some difficulty in diagnosis because some of the symptoms do not present themselves very often. And in Singapore, it's not unusual for an asthmatic child to be diagnosed only after repeated visit to the same doctor. Just simply because if the child is wheezy, having difficulty breathing at home, doesn't mean that when you go to the doctor, you'll present the same symptoms. And even after diagnosed, it's really difficult to measure how their treatments are going because it's a long battle. And right now for asthma, including sometimes COPD, the patients would just prescribe with journals to kind of journal down what the symptoms are, how they feel throughout the treatment period. So these present some real challenges. What we create is simply a very small stethoscope. It's about 3 centimeters in diameter, where you can wear on the chest for a long period of time. Essentially, it is a digital stethoscope that is connected to the cloud. But what is on top of that is there are a little bit of machine learning that measure the heart rate and respiratory rate on continuously, and also is able to recognize some of the signature abnormal chest sounds that usually will occur for chronic respiratory disease patients, such as wheezing. It's pretty small, and during one thing that it can do is, as we move towards a post-COVID era and teleconsultation will become more and more common, this also serves as a stethoscope to help telemedicine doctors to escalate their patient. As I've roughly shared just now, our current focus is on chronic respiratory diseases. There's asthma and COPD, but there are also other verticals that we are looking to expand into, where acoustic chest sound will give enough information to help medical doctors make more informed decisions. This device has been through a series of tests, and I mean, I'm quite happy to share that it is market ready in most parts of the world now. In a very recent performance test that we do to fulfill some FDA requirements, we found that our device, I'm happy to say that we found that our device have quite good accuracy in terms of both vital signs measurement and also the detection of abnormal lung sound. We did survey with doctors across the globe, both in the West and the East, and of course also in the Middle East, that many doctors and patients has rated the usability of the device to be somewhat good. Just a little bit background information about the company. We actually started in 2017, right at the start of the company. Our company is actually in Dubai for accelerator program that I'm happy to share if anyone is interested later. We're currently at pre-series A stage, and our device is going into a couple of markets following this year end. This is my management team together with me, with Dr. Karen and Adrian. So that's all my sharing about my company and our product. Happy to take any question if anyone has any.
Thank you, Dr. Tan. Young and promising. Your technology remind me another successful company that I met them where they were a young company. Their name is iRhythm Technologies. And for the kind of general education of the audience, iRhythm today is public on NASDAQ with a market cap of $2 billion. So hopefully you can follow the footsteps and even more. I have one question for you. You definitely have an interesting product, and I think that there's no doubt that you got some interest from the GCC market. I would like you to share with the audience, how did you find a partner in the UAE at such an early stage?
So it's a mixture of a bit of a luck and also our active effort to look for a partner. As I briefly mentioned just now in my deck, in 2016, end of 2016 to the mid of 2017, before the company is completely formally started, we actually took part in an accelerator program in Dubai. And we spent half a year in Dubai. And we saw firsthand how the medical system, at least in Dubai, works, and grew our confidence of the ability to be able to expand both the development of our technology in the Middle East, in UAE, and also as a market. So after we came back to Singapore, we actively engaged to agencies in Singapore, government agencies like Enterprise Singapore, and now of course agencies such as UAE Business Council for introduction. So we are quite persistent in that, and eventually we got the right contact and right introduction, and very luckily and thankfully we're linked to a potential business partner in Dubai. So and after a couple of months, and we found that our interests are aligned, and happily last year we formed a partnership.
Excellent, and I'm sure that our audience today would love to hear more from you in the future.
Thank you.
I would like to invite our third panelist, Mr. Tirupati Karthik, to discuss his company, Napier Healthcare, and introduce himself and the company. Mr. Karthik, welcome.
Thank you, Dr. Aitan. Let me quickly share my screen. Thank you for the opportunity to the UAE Singapore Business Council, as well as the eminent speakers that were ahead of me. Very interesting presentation by Dr. Ibtesam as well. My hope is to quickly cover an introduction to Napier. We are a fairly old company in this business. We were actually the earliest pioneers of healthcare technology way back in the 90s. So my attempt is to quickly give you a run through what we have done so far. The focus has always been on innovation, and we've used that to drive the internationalization in the last 10 years or so. And I'll also be touching briefly upon the value proposition that we provide in terms of the technology products. Internally within Napier, we believe we provide an incubator for all our various functions, and that's how we promote innovation internally. And that's how we've been constantly and consistently delivering innovation to the marketplace for both acute care hospitals as well as long-term care, nursing homes, home care, and some of the others. We proudly fly the Singapore flag in 9 markets. We are present from the Asia Pacific onwards, Australia, New Zealand. We are there obviously in Singapore, India, which is our development center. We're there in Malaysia, Saudi Arabia, where we have presence. We are in East Africa, while it does say Tanzania, we are present in Tanzania, Rwanda, and also Kenya. And definitely the United Arab Emirates, which is our headquarters for the Middle East regional headquarters. And I'll speak a little bit more about it later as well. We started our journey sometime in the 90s when we actually built, in those days, very interestingly, the then president of India was Dr. APJ Abdul Kalam, who was a keen person wanting to bring space technologies into healthcare. So we launched telemedicine with a local hospital in Hyderabad. In those days, I'm talking of 2002, that's the picture that you see here. And since then we've been working on that, but nothing has helped the cause of telemedicine as much as the last 2 years, where accessibility to healthcare became a big issue due to the pandemic. And till date, I think my personal view is the biggest challenge in healthcare is not the doctors, it's not the facilities, it's not the infrastructure, but more the accessibility. And personally, I feel telemedicine goes a long way in solving that problem for us. Because in the world today, even today, there are about 80% of the people who are not able to access healthcare because of them being in remote communities in large countries. Fast forward, I won't go through every one of them, but we've done some innovations. We, for example, launched Aviation Medicine in 2016. Today, the Napier EMR runs the licensing for all pilots and air traffic controllers that are registered with the Changi Airport, the Civil Aviation Authority. And we came out with the cloud instance way back in 2017, 2018. Today, a lot of our customers are on the cloud. It makes for a very cost-effective deployment, not to mention the fact that hospitals have, some of the smaller hospitals like the 50, 70 bedded hospitals have gone live in a matter of weeks, instead what used to previously take about 10 years or so with the HIS implementations. 10 months or so, not years, my apologies. In 2020, we, with the onset of COVID, within a couple of weeks, we actually launched our own AI solution that would detect pneumonia based on the X-rays and the other imaging solutions. We then subsequently expanded it to include 13 other such conditions that could be read off the images that were made available. Very proud also to share that we continue to be the only non-American company in the US which has received a meaningful use stage 2 certification. For many of you who are in this business, you might recognize names such as the Epics and the Cerners, who were big beneficiaries of Obamacare on account of this certification. Napier happens to be one of the the only non-American company in that certification list. So we're quite proud of our achievement there. With that as our arsenal, we started the internationalization. But before I talk about how we went about our internationalization, a very quick point that I think even Dr. Ibtesam mentioned in her address. The Bloomberg report does track Singapore as one of the top countries where we get more bang for our buck the way we manage our healthcare system. And the Bloomberg index also looks at the expenditure of a country and also the life expectancy that it generates. Based on that, you can see that Singapore has a life expectancy of 83 years average, whereas just obviously US is always a comparison. They spend about 18% of their GDP on healthcare, whereas Singapore spends about 4%. So I think that does make Singapore a natural partner to UAE. Both of us are in the quest for the same kind of objectives, and some of the products that we build in Singapore are for the Singapore customers, and so some of those learnings are also automatically built in the technology that we provide to our other customers in other countries. Uh, how did we get into the market in the Middle East? We obviously looked at UAE very favorably because of the size of UAE, which is similar to Singapore, and also because of the progressive nature of policy making in UAE compared to the rest of the Middle East. Not surprisingly, the rest of the Middle East also looks up to UAE for ideas and so on. So we thought UAE is the right place. We are located in Dubai as our regional headquarters. We did our initial market study, and we looked at the acute care segment about 3 years ago as the place where we wanted to make a mark. And today I'm happy to report that we have some customers in the region that we can share with you later. Uh, Once we do that, we always work with customers on a preferential basis, what we call as alpha customers. And needless to say, we do provide them very favorable commercial terms, and the relationship is obviously very strategic to us as it is to them. Uh, we have a lot of partners. You can recognize most of the big names here. We were one of the earliest adopters of the Microsoft Azure cloud platform way back in 2014. And the AI is something that also appeals to all of them. We worked with the IBM team for the Watson solutions, which is quite famous in those days globally. What is our value proposition in the region? Napier's firm belief is that healthcare must be delivered on what we call as a care anywhere basis, which means even in places like larger countries, as a patient moves from one format of setting, clinical setting, to another, their records must move seamlessly. In Singapore, we obviously were one of the earliest adopters of a nationwide EHR, and that did help us a lot. But most of our solutions are also therefore conceptualized on that basis, that someone coming into an acute care may eventually land up in the long-term care, and then may go to home care, and then maybe day care, and so on. So we take care of all of those process workflows in our HIS system, as also in our nursing home care and the long-term care, the rehabs, and some of the other solutions that we provide. Innovation, as always, is a cornerstone of what we do. But more importantly, we also measure ourselves very strictly on the ability to deliver a transformation to hospitals and nursing homes and home care providers. Some of the products, I don't want to go too much into this. We are a HIS vendor. That's how our life started in the early 90s, subsequently adding on EMR in the first decade of our existence. Residential care, center-based care, home health care, transitions of care, the aviation medicine, and the AI, which we have been now providing for the last 2 years or so. That's kind of, in a nutshell, our products. What is our differentiator? Again, a busy slide. I won't want to go into every line of this, but we are in a unique position as Napier that operates in about 9 different markets, ranging from Australia to Africa. So what it does is it exposes us to, as we build these products, to business practices of various hospitals, various home care, various nursing and residential care organizations. As we build out features for them in the software, we are then able to share it as a best business practices repository when we go into a new country or a new facility, for example. One of the things I would like to highlight is Singapore, for example, in the long-term care has come up with the enhanced nursing home standards. So when you buy the Napier nursing home solution or the home care solution, these standards, these processes, best business practices actually are built in. So you can get all of them. You can get a standard set of care plans that are available. Obviously, you can build your own, but that's kind of how we work in providing best business practices. All our customers are stakeholders and partners in our journey as we build these features. Needless to say, the modern tech stack guards against obsolescence. We believe someone who buys a Napier technology today for the next 8 to 10 years would not have to upgrade their technology at all. With that, I just want to use this last 1 minute to talk about security. In the last 2 years or so, because of the pandemic, the number of security incidents have gone up by almost 200x. I'm not talking of 200% or 2x or whatever. I'm talking of 200x. For us, who supplies core technologies to hospitals and other providers, this therefore becomes very important for us to make sure that we protect them from ransomware and some of the other things. So we spend a significant portion of our R&D expenditure in trying to make sure that we work on the latest top 10 security issues that are there, and we consistently and constantly update the technology to do all of that. With that, I'm just going to stop and see if you have any questions that I might be able to answer. Back to you, Dr. Aitan.
Thank you very much, Mr. Karthik. I have one question for you, and it seems that you have an interesting IT solution, but my question to you is, how do you compete with the large top multinational companies in the GCC market?
I think in terms of our value proposition, I think there are large companies and there are smaller companies, but we have a very niche, in the market space that we operate in. We are recognized as the top Asian company for supply of HIS and the other core technologies that we provide. But that is in terms of the product itself. But if you look at what we do, the way we work, whenever we enter a new geography or we work with existing customers, they actually tell us the features that they want on a quarterly basis. We have an agile methodology that basically delivers it to them in the following quarter. That's how we protect technology from becoming obsolete. If you go back to the olden days, when you bought a technology or a license software from a vendor, you would probably want to upgrade it every 2 to 3 years and spend millions of dollars trying to do that. Today, with this kind of an approach, we are able to do that in probably a fraction of, say, $5,000 or $10,000 kind of upgrade, but more frequently, and that keeps them up to date. So I think innovation in a nutshell is probably what drives our partnership with our customers. At that point, it does not matter whether you're big or small. It only matters whether you're fast or slow.
Fascinating. Thank you very much. And with that, we will move to the second half of the panel, which is Q&A. And I will ask each one of the panelists questions that were generated either by the audience or we had them prepare ahead of time. My first question, or my first topic, is kind of extension of what you mentioned right now about innovation. Innovation in medical devices in health tech is about doing good. We are living in an era of a global pandemic, and COVID-19 has magnified and emphasized the disparity in access to healthcare. Some people are able to live healthier lives and have better access to healthcare, and others cannot, entirely due to their status and the location in which they are born and live in. Can you share with us, and I will start with Raymond, can you share with us your view on how innovations in healthcare and medtech can help rectify these inequities and ensure that all people, wherever they are, whoever they are, will be able to access quality healthcare services when they need them? We know that at least in the US market, a lot of the innovation is directed into the rich Western market, where the spending on healthcare is substantially higher than Asia. in other places. But with the view of we are inventing to do good for mankind, can you share with us your opinion?
Okay, cool. So yeah, I think also to extend what Mr. Karthik also shared earlier, right, that in fact, I mean, no matter how disruptive or how innovative the healthcare solution is, and also, you know, regardless of whether or not government is funding or subsidizing the cost of medical services, I think patients in general, they are more often inconvenienced by the physical limitations and the accessibility issues. Therefore, you know, we have seen a burgeoning, you know, number of so-called a renewed model in terms of the delivery mode of the healthcare service, playing a much more important role than before, especially during this period of time, right, whereby people are scared of, you know, stepping out of their home, or, you know, they are really too sick to walk out of their home, and therefore, you know, the remote consultations, the telemedicine, and all this, you know, essentially becomes a savior to many, right? And with internet, I believe, you know, people can access such services online. They can, you know, receive the professional opinions of the physicians in the comfort of their home. And of course, to many people, a peace of mind. They just want to, you know, consult for the sake of, you know, as an assurance, right? So for our case, in our company, we are basically dealing with two issues right now, right? So number one, how can we decentralize high quality medical service, especially in the suburban or even the rural areas itself, whereby the doctors are simply not well trained. Okay, so we want to, you know, in a way scale our AI-enabled expertise. Why? Because when we train the machines are essentially learning from the best brain specialists or the lung specialists in the top hospitals in the world itself. And instead of these people having to travel all the way physically, take a train, take a flight, you know, having to take a queue in the city areas, you know, can they benefit from these healthcare services in the hospital in the vicinity? The answer is yes, it can be done. So that's how, you know, when we expand our innovations, we also make sure that we also cover, you know, this part of the market itself. At the same time, you know, we are also talking to teleradiology companies, right, to incorporate AI solutions, because the objective is that it's not about money anymore. I think a lot of teleradiology companies, they are quite well funded, but I think essentially is how to admit, how to, you know, receive or address or access more patients in the same amount of time, because essentially time is not money, but time is life.
Excellent. This is interesting, as Dr. Ibtisam mentioned before, the concept of doctor for every citizen. Now, with your technology, it can be augmented by AI to reduce backlog and to increase accessibility. Dr. Tan, what is your view on this topic?
So I of course agree with what Raymond said. I think accessibility to healthcare, to medicine in general, poses quite a lot of challenges. So at least in my opinion, there are two that I think is most concerning. So there are two factors. The first is distance to the healthcare. The second one is cost of acquiring this healthcare. So both contribute to reducing the accessibility to a big population in parts of the world. Just for example, distance. I think just to say, if there are silver linings to the COVID-19 pandemic, that is one of it will be it accelerated a lot in remote healthcare. Not only just telemedicine, but also devices that people can bring home healthcare to plug into the gaps of telemedicine and remote health. So that brings a higher level, higher quality of healthcare to the homes of people. But of course, we still do understand that some of this technology requires internet connection and things like that. But it takes time, you know. We are getting there. So we're trying to shorten the distance from individuals to the accessibility to access to healthcare. Not necessarily, I mean, there are conditions you definitely need to rush to the clinic or to the hospital, but what's before, you know, you can, part of managing the health problem can be done at home. And right now, this is not possible because a lot of this, up and coming innovations, the wearables, the home healthcare devices, yes, the idea is out there, they are out there, but either they are too expensive or they are not that market ready yet. So that's distance, and cost is the other thing. I do see a lot of innovation that comes. They're just, although they are new and they're supposed to address problem of accessibility to healthcare, but they're still priced out of reach of many. So I think one, or at least my company goal, is to make technology accessible enough, a low price enough, even if an individual couldn't afford it, it is affordable for governments or for charitable organizations to provide these services to each and every individual family or things like that. So I think one good example will be in Singapore. Some organizations in Singapore are distributing pulse oximeters to everyone. Before this happened, I think most Singaporeans wouldn't bother having a pulse oximeter at home. But this is one, oxygen saturation is one of the critical indicators of deteriorating medical symptoms for doctors when they're in hospitals or in the clinic. But previously these things are really expensive. But why would organizations be able to provide them now? Because if you go onto some of the distribution websites, you can find high quality pulse oximetry at $6 or even less. So one of these things is how do we lower the cost of our innovation? Not how we make this innovation, but the cost of our product. One thing personally, I really felt that my company Core Technology has been around for close to 10 years. But it was only in 2017, 2018 that we think cost of the hardware is low enough and is advanced enough for us to make it a feasible product. And that's when we started. So hopefully we move towards this direction in the next decade, and maybe shorter term in the next couple of years, as higher computing power become available at a much lower cost. That there will be an emergence of wearables and home healthcare devices that can bridge this gap and bring healthcare closer to those who don't have access to at this moment. At least that's what I hope right now, yeah.
Absolutely agree, and I think that innovation in the value segment is the most important and also the most difficult. A previous generation of innovator was focused on producing the best devices to improve healthcare without cost consideration. Our current generation has to consider cost as another part of the innovation, which makes it really hard. Mr. Karthik, maybe you can share with us your view on how we remove these inequalities and have healthcare accessible to more and more people.
Yeah, I think I have quite a few points which I wanted to share, but foremost is that I want everyone and anyone who's thinking of innovation to move away from radical, revolutionary, once in 4 or 5 decades kind of innovation. How often are we going to get a Google coming back and starting something new, or iPhone, for example, or another company like Apple? Steve Jobs did that twice in his career, once with the Mac and then with the iPhone. I haven't come across any such inventor yet. So my focus always has been, let's look at innovation that we can do every day incrementally in our own way. So when you look at that, a few things come up. For example, AI seems to be a very frequently spoken of subject, right? I was reading somewhere the other day that if I were to classify AI as an industry in 10 to 15 years from now, it will be bigger than what we know as the IT services industry today. That industry today is worth, I think, some 200 or 300 billion dollars or something like that. So AI will outpace that, which means we have to look at AI in everything we do. It cannot be that I'm dumb for 19 hours a day and about 5 or 6 hours a day I'm going to be very intelligent. That's what it means if you say I'm going to set up an AI solution or an AI department or an something that only does AI or is intelligent only for a certain period of time. We have to be intelligent throughout. When you look at that, the definition of innovation changes. So we came across a lot of ideas, but our AI team that looks at and sieves through all these ideas is going through some. But I just wanted to bring one point. Let's assume that there is an increased chance of, in Singapore, we get rains 4 or 5 days and at a stretch sometime, right? So what that means is there will be people who will get triggered with, Dr. Tan might be more interested in this asthma, for example, right? So can I take the weather patterns correlated with asthma and then say, in those pharmacies in that area, can I stock up something ahead of time? We do get weather reports 1 week, 10 days in advance. So this is a kind of innovation. You can collect the big dots and see what you can do with it. So AI can become predictive, not only looking at what, for example, what we've already delivered. If you give me 100 x-rays, I can tell you the AI can look at it and say the top 5 are abnormal and therefore they must be attended to first. And I can probably bring forward the diagnosis or the curative process a little earlier. But think of AI by connecting a lot of seemingly unrelated dots. That's one. The second.
Thank you, Mr. Calder. I think that I want to squeeze another question. We have another 10 minutes and I have another important question for all of you. And it seems that our panel agrees that two things need to happen. One, AI need to be anywhere and everywhere in healthcare. And two, the devices that the AI controls or interpret should be more efficient and more cost effective. So that's my conclusion. I would like to bring the discussion in the 10 minutes that we have to what we heard from the UAE officials. We heard a fascinating thing. We heard that in Abu Dhabi, Audio rolled out an innovation program which will provide a stunning amount of close to over $500 million of rebate and grants to foreign companies to support their growth. We heard that in Dubai, the Dubai government established the Dubai Healthcare City, which is, and it's amazing for me, is the world's largest medical free zone. I wish we had it in California. And this providing all-inclusive business setup, including maintaining 100% ownership. Fascinating opportunities, and I would like to bring it back to you and each one of you, and we'll start with you, Raymond, but each one of you, what was the pull factor that first attracted you to expand to the UAE? It's not an obvious decision, but you still did it. And the other one, is there any crucial advice that you can share with our audience as a prospective partners that will come to the UAE? We have only 10 minutes left, and I would like each one of you to maybe do 2 or 3 minutes.
Okay, then. So yeah, and definitely, I think the aspiration of UAE, the government as a whole, to position UAE as a medical hub really speaks volume in terms of how visionary and how ambitious they want us to be, and that really excited us in the beginning. But really, in terms of the market itself, we're talking about $1 billion market in UAE. We are seeing that within GCC and UAE in particular, right, the government, not just the authorities, but the government-funded hospitals and private hospitals, they have already started to study and to accept digital health and health tech applications, and this has really become the next norm. Just now I think earlier speakers talk about home care monitoring, AI as an assistive tool itself. So essentially, we are seeing a burgeoning market ready from the top and from the bottom, from the market to the authorities itself. It's a very nice ecosystem itself. A very important part is the recognition of Singapore brand value, right? And we also realize that professionally, I think between UAE or GCC as a whole and Singapore, the medical arena itself, there's a lot of a healthy, constructive exchange and collaborations all along, right? So we want us to ride on this bandwagon. Take, for example, for us as a medical device company, it's important for us to obtain a medical device certification. So when we start to, before we expand into UAE, we realize that Singapore HSA has a very strong bearing in terms of the acceptance by the doctors within UAE, right? So that's when we also ride on this bandwagon. So when it comes to what can be done, especially for young upstarts upstarts like us, right? Because we don't have a lot of money to burn, so it's very important that we dream big, but we start small and then we scale fast. And therefore, before we channel ample resources into new markets, it would be prudent to do a deep stick analysis of the market. So that's when we have a good start, because we already get in touch with the Enterprise Singapore, the UAE Business Council, to accelerate our initial market sensing. And that through this profiling, through these relationships that they have to connect us with, it really helps us to iterate our business model at an early stage, and that helps us to scale faster than without this catalyst. Yeah.
Excellent. Thank you, Raymond. Dr. Tan, in 2 sentences, what was the pull factor to go to UAE, and what's the best advice you can offer the audience?
Okay, so my partners and I see firsthand what the Dubai city looked like, and the openness to innovation, not only by the government, the agency, the hospital, but also by the individual doctors, and the enthusiasm into moving to the next stage of medicine, complemented by technology. So that is one, at least maybe I'm the CTO, that's one of the most important pull factors for me. And what I think is one of the most important thing, crucial step before going to the UAE as a market, is to really put your boots on the ground and take a look and talk to people and see how it works. It's, especially for Singapore company, it's a little bit different, but it is as exciting, and that actually helped us a lot when we look for partners and for us to decide what would be the most likely strategy to enter in the market. So put a foot down in UAE. Yeah.
Excellent advice, Mr. Karthik. I'll give you the full 3 minutes left.
Thank you so much. I think for me, foremost would be the fact that Dubai is a regional hub. There is connectivity. For us, we look at healthcare as being directly proportional to the number of people in a country. So by that yardstick, GCC, the biggest market would be Saudi Arabia. And to find people in Saudi Arabia, setting them up and doing projects there was going to be very tough for us. But when we set that up in Dubai, it was very easy. Setting up an entity in Dubai, for example, was a breeze. The same thing, even after about 15 or 18 months for us, was not easy in Saudi Arabia in those days. So I think that was one reason why we obviously chose Dubai. Very friendly policies to business and connectivity to Saudi and also to Africa, which is a key market for us. Lastly, any implementation we do in UAE, everyone looks up to UAE and Dubai in specific in our industry. So I think that's an obvious conclusion there.
So we are hearing, to summarize, we're hearing that everybody had a very warm welcome. It's a hyper-connected region. The market is large and a lot of support from the government.
Yeah.
Thank you very much to all of you. And I would like to give the stage back to our chairman, Dr. Shagar. Thanks all the panelists. Appreciate your time and your wisdom.
Thank you, Dr. Aitan. Excellent moderator. Thank you.
Thank you.
Thank you.
Thank you so much, Dr. Constantino. And all the panelists. I think it was really exciting for me as a banker to see the role of capital in the democratization of healthcare. So really exciting, and thanks for sharing. To round up today's events, I have the keen pleasure of inviting the President of UAE Singapore Business Council, Dr. Brian Shigar, to give the closing remarks. Dr. Shigar, please.
Thank you very much, Rani, for your kind introduction. His Excellency, Jamal Abdullah Al Sawaidi, UAE Ambassador to Singapore and patron of the UAE Singapore Business Council. Distinguished presenters and panelists, ladies and gentlemen, global healthcare spend per capita has steadily grown over the years, particularly in the recent past. In the UAE, healthcare spending increased from AED 3.8 trillion dirhams in 2016 to AED 4.8 trillion dirhams in 2020, representing 7% of budgetary expenditure. The UAE's medical device market is expected to reach AED 5.6 billion or Singapore dollars 1.5 billion by 2025, representing an annual growth rate of 4.4% from 2020. Therefore, it is indeed timely for the UAESBC to organize its first Healthcare and HealthTech webinar. We have received informative and interesting presentations from various experts in this sector. UAESBC members, Mr. Steve Weissner of Singapore Medical Accelerator and Dr. Arpan David from Whitehall Hub have leveraged their expertise and experience in GCC, UAE, and Singapore and the US in delivering a very broad overview of this important and growing area. They have clearly demonstrated that global medical device markets will continue to rise in line with increasing healthcare spending and population growth. Most certainly, we can expect this phenomena to be significantly exhibited in the UAE. Mr. Muhammad Omar from Abu Dhabi Investment Office showed in his presentation the importance of the Emirate of Abu Dhabi regarding investments in biopharma sector, particularly in the domains of vaccine production, digitization, and telemedicine. Abu Dhabi's GDP contribution to healthcare and biopharma, which was 87 billion in 2019, is expected to increase to 89 billion in 2025. Dr. Ibtisam Al-Bastaki from Dubai Health Authority highlighted that health spending in Dubai has risen by 4.8% from 2018 to 2019. And opportunities exist for increased investment and growth in the healthcare sector. She has also indicated that the Dubai healthcare sector over the past 10 years has witnessed an increase in the number of hospitals from 26 to 39, with concomitant growth in licensed professionals and outpatient and inpatient volumes. The UAE is delighted to have in our panel homegrown medtech and healthcare entrepreneurs, namely Mr. Raymond Ma from Biomine, Dr. Rex Tan from Avis Health, and Mr. Tirupati Karthik from Napier Healthcare. They have all shared with us their innovative products and services and experience in leveraging the UAE's healthcare and medtech sectors. The panel was ably moderated by Dr. Aitan Constantino, co-founder of Singapore MedTech Accelerator and fellow EXCO member of the UAESBC. And he has a distinguished international background in this domain covering Silicon Valley, Tel Aviv, and Singapore. Now, for those who are participating for the first time in our webinar, let me just say a few words about the UAE Singapore Business Council, which is the sole business nexus that promotes business-to-business connectivity between the two countries. Our patrons include the UAE Ambassador, His Excellency Jamal Al-Suwaidi, Chairman of Business China, Mr. Li Yishan, and Chairman of Russell Khaimah Chamber, His Excellency Muhammad Ali Al-Nawami. Our executive committee comprises the large UAE companies operating in Singapore and major Singapore companies that have business activities in the UAE. Our membership covers a wide variety of business sectors and comprises both companies as well as individuals. We are an active business council that organizes seminars, webinars, quarterly talks, networking sessions with other chambers and trade associations, and the organizing of business delegations to the UAE. As a Singapore registered business body, our primary objective is to facilitate for Singapore companies greater investment trade opportunities in the UAE. I want to thank our guest of honor, His Excellency Jamal Abdullah Al-Suwaidi, for his opening address. I also want to again record my gratitude to the presenters, Mr. Muhammad Omar, Dr. Ibtisam Al-Bastaki, Mr. Steve Weissner, and Dr. David Arpan, and our panelists, namely Mr. Raymond Ma, Mr. Dr. Rex Tan, and Mr. Tirupati Karthik, and of course, the panel moderator, Dr. Aitan Constantino. Their collective involvement and contribution has greatly contributed to the success of this webinar. I thank our MC, Ms. Rani Kaur from Bank of Singapore for able conduct of the whole webinar, and Ms. Huda Al-Junaid, Head of UAESBC Secretariat, for diligent organizing efforts. Last but not least, on behalf of the UAE Singapore Business Council, I thank you all participants from both Singapore and the UAE and other countries for being part of this interesting webinar, and we look forward to your participation in our future events. Thank you very much. Over to you, Rani.
Thank you so much, Dr. Brian. It's always a pleasure hearing from you. Ladies and gentlemen, we've now come to the end, unfortunately, of the Opportunities in Healthcare and HealthTech in the UAE webinar. On behalf of the UAESBC, I thank you all for your kind attention and participation. We welcome your comments and feedback via email. To contact us at uaesbc.com. It's all over the LinkedIn, social media. Please, get online and connect with us. Until our next event, I'm sure it'll be another exciting, fruitful one. Thank you all and stay safe. Cheers.